Quick question from a chiropractor. How important is a consultation? We've had a number of people calling us and asking if they even need to have a consultation, or can they just come in, we do a few things with our hands, maybe a quick pop, a quick crack, and then they carry on their way. And the reason why it's so important to have a consultation is, number one, of course, for more accurate diagnosis, to make sure we're doing things as best as we can for the best interest of a patient. And for a big part, it's also about safety. So at least here at Vitality, we don't even start first with a consultation. We usually would start, depending on the case, with a call with myself or my colleague before even coming in, to make sure that they are the right fit and that there's nothing else that may be going on. And then after we have that, we have a consultation, going through tests, going through more questions, and then we can determine if we are the right fit and if things are safe to go forward. And the reason why this is so important is because recently we had a patient who, they sent us some information about some of their symptoms. It sounded a bit complex, so I gave them a call, and after a few minutes of talking with them, the first thing I had to say to them immediately was, please go to the hospital, please do not come in to see us, please go straight to the hospital right now. I checked in with this patient a week afterwards. The patient was having a stroke. The patient, unfortunately, had been suffering from a stroke. They had had what they call thunderclap headaches. It's the worst kind of headaches they've ever experienced, coming completely out of nowhere. And this patient was over 60 years old, so you'd expect that if they would have had some level of headaches, which for them may be normal, they should have had it earlier in life. But unfortunately for this patient, she was having this and she was having a stroke. If she came in to see us and we hadn't been doing any testing, we hadn't been doing any kind of verification of what's happening, doing any kind of scans, asking her more questions, it would be dangerous and it would be very, very unethical and unprofessional. For this particular patient, the good thing is that she went to the hospital. They do very well with emergency care. They're able to help her a lot better. She is not losing any kind of, big motion. She's not losing her ability to walk, but she is still suffering from some of those headaches and those other symptoms. And it would be, of course, the wrong thing for her to have come in to see us, as we would not be the right fit for that. So if people ask us, is a consultation necessary? 100%. Not just for us, it's also to make sure that it's safe for the patient and that myself or any other practitioner are the right fit to help that person as much as possible. If you have any questions about this, leave them down in the comments.